Okay, Connie is back in the chair for some well-deserved maintenance here, and it does take maintenance. Anytime you're doing injectables, you know it does take some maintenance here. So go ahead, and this is what we're going to do. We are going to do, she's all cleaned up already, really scrubbed down, all cleaned up and ready to go. We are going to do just fill these slight nasolabial folds that she has got there, and then go ahead and purse your lips here. And you can see she has got some very, very fine radial lip lines that she does not like. Just go ahead and relax there again. And we are going to take care of that. Now, she doesn't usually like those nasolabial, the radial lip lines with botulinum toxin. She just doesn't like the way that it goes ahead and feels to her. So what we are going to go ahead and do is place some filler, and you're going to see how we're going to treat this filler when we do some radial lip lines there, and we'll talk about the materials we're going to use too. She also has, if you look closely, and you can bring the cameras in just a little bit more closely, she has a little bit of like pebbling of the chin. Just relax, and also just the skin texture. She's got some really, really fine lines, so we are going to use filler for that as well. In addition, we are going to come back and use some botulinum toxin treatment on her. But we are, if you see these really fine lines here and there, that is what we are going to do with some filler. We're going to use a mixture of light and medium fillers on here, depending on the areas that we're going to use. We are going to use, in this case, the Allergan products Velour and Volbella, and we'll talk about why as we are using them. So we're just going to go ahead and get started. Now, if you're doing this kind of, I guess, enhancement on the lower face, you're going to start with the nasolabial folds, get those out of the way first, and then come back and do a combination of some of the other things that we're doing too. One thing that we are going to add, as you can see, especially with these fine lines that we're going to add, you want to go ahead and you want to use products that are hydrating. And this is something that we don't talk about enough when we're using fillers, is there is a hydrating element to fillers when you go ahead and place them in there, which is also very, very good for the skin here. So I'm just going to put her back up here just a little bit. We're going to reposition our cameras. I need you to come around to the front just a little bit more on this camera here. And you can all kind of pull in just so you can get right into this here area first. But let's go ahead and do that. So for this, for the nasolabial folds, we are going to go ahead and use Velour. And Velour is one of the more flexible materials. It's a medium filler, and it is, like I said, definitely has some hydration there as well. So I'm just going to add some filler right in here. She's going to feel a little bit of a pinch. I'm going to hold the skin tight just so I can easily slip in right underneath it there. I'm going to go ahead and aspirate. Don't see anything there. Never assume that you are in a safe place. That's part of the AAFE Safe Injection Perfection Protocol here. I'm going to do some fanning in this area right here, as you can go ahead and see. And that filled up quite nicely. I can feel the material right there. I'm going to go ahead down just a little bit and fill up this whole area right here, as you can go ahead and see, and just add a little bit more right in here. Going to go in there. Part of the whole AFE Safe Injection Perfection. Aspirate, but you are doing retrograde injections. You are never going ahead. You're going to keep that needle moving. You're never going to go ahead and put a big bolus in any one area. Here you can see how nicely that has gone ahead and filled up, and it doesn't take very long. I'm going to do all this in real time because Connie and I are always in a hurry, so we might as well get this done as quickly as possible. So here we're going to go again, see where we want to go ahead and enter, right into that nasolabial fold, and going to go ahead and aspirate. Don't see anything there, and we are going to go ahead and deliver. You can go ahead and bring in those cameras a little bit more. If you want to get a little bit more of a close-up view, we're just going to do some fanning. As you can see, we are just going to keep that needle moving. Does not take long to deliver. I can feel the material right there as well here. So let me go ahead and just get my fingers back to where we want them here. And I'm just going to go ahead and add a little bit more right into this nasolabial fold. And I'm just going to aspirate, nothing there. And we're going to go ahead, retrograde injection, keep the needle moving. No big boluses anywhere. And we are pretty much done with the nasolabial folds. And as you can see, full face, they have gone ahead and filled up quite nicely. And because velour is more of a flexible material, it is going to go ahead and move with the face a little bit there too. So I'm going to smooth everything down in a little bit once I have everything together, but that looks really good there. So now let's go ahead and move on to these radial lip lines that she doesn't like, especially in this upper lip. So we have done this in the past with her, and it's worked out very nicely. We are going to use Volbella, which is a thin filler. It's a great thin, soft filler. Other thing about Velour, it is softer than the Juvederm Ultras and the Restylans that are there. So we're going to go ahead and use Volbella in these lines. But watch how I'm going to place this. Many times, if you see, and she has got very, very faint radial lip lines, which she does not like, but many times when you see people place, they go ahead and they place filler in these radial lip lines, they'll go up and down the lip lines here. And again, botulinum toxins are great to use for this. We always use that first. In this case, Connie does not like that. But many times you're going to see many people will go up and down those radial lip lines. And what usually happens is you get a very bumpy appearance. It's hard to smooth down some of what you're doing. It's just a little bit, it never seems to come together very well. So we're going to show you the AFE injection technique for radial lip lines, and we are going to go across these radial lip lines just like this, and that's going to support all of these lip lines that you have right here. Yes, we could certainly use solid filler smooth PDO threads for this as well. This, though, is going to add a little bit of hydration to this area there as well. Now, I'm using a light filler because I'm going to turn you this way just a little bit. People can get a little better view of that. I am using a light filler primarily because we are going to go ahead and I don't want a lot of bulkiness here. That's the big reason I'm going to use this. So we're going to start here. You're going to feel a pinch here and just some distraction. We are going to aspirate. We are going to go ahead and deliver. Now watch me deliver this just slightly. I'm not putting a lot in any area. I'm going to fan this whole area right here and just going to keep that needle moving. And it's an area definitely where you could get some bruising for sure. I'm not putting a lot in. In this whole area, I probably put in only 0.05 because I don't need a lot. This is also a little bit more of a superficial injection here. I'm just going to go down here, place a little bit right in here. And again, I'm going to aspirate here, and I'm going to go ahead and deliver, keep that needle moving. When I fan, I go to a different place, and I go ahead and just give a little bit is all we're doing. And again, it's more of a superficial injection. Now, if you take a look at this, you can see that there is not a lot of bulk, but there is a lot of what we placed right there to just superficially very smooth out those lines, and it's done a really good job right there. I'm going to move around to the other side, and I'm going to turn you this way just a little bit to make it easier, and people can see this from a bunch of different angles there. So let me go ahead and do the same thing here. And how are you doing, Connie? Okay?
Yep.
Yeah, she hasn't moved throughout this whole thing here. So again, these are the lines I want to cover. I'm going to go in here again more superficially and just a little distraction there, a little bit of aspiration. I'm going to keep this needle moving. No big boluses in any areas right there, so you can see. And I'm just going to deliver right underneath those lines, crosshatch, and that supports it almost like kind of a strut underneath it there. And I'm going to do that again. Now, if you look really carefully, you can see some of these very fine, venous structures here, veins that are there. I'm going to go around them to try to prevent bruising. Bruising is always a possibility. Don't have much left in this syringe because I don't need much left in this syringe. So as you can see, I'm just going to go ahead and place the rest of that syringe right in there. Nice. Doesn't look bulky at all. It looks nice and smooth. And we are going to go ahead and smooth that right now here. So let's go ahead and do that. We're going to come back with arnica. As you can see, you are always going to get a little bit of swelling, not much, especially with a light filler, a little bit of swelling. You don't see really any kind of swelling in the nasolabial folds right here. This may be a little bit, but it's going to add hydration. It's going to add a little bit of support right around there. So that looks really, really good. So now we're going to come back in a little bit and do the lower face with some of that filler as well.